Laser vision correction is not magic and not a new lens. It is precise work on the cornea, the clear front part of the eye. We change its shape so light focuses properly on the retina. That can make it easier to see without glasses or contact lenses. But the most important point is simple. This is not for everyone, and the best result always starts with proper patient selection, not with a loud promise. Most people come because they want freedom. They want sports without glasses, fewer fogged lenses, less morning hustle, better comfort at work or on the road. That is completely understandable. But laser does not solve every case. If the prescription keeps changing, if the cornea is thin, if dry eye is severe, if we suspect keratoconus, or if there is active inflammation or another eye disease, we need to deal with that first. Sometimes the honest answer is treat, observe, and only then come back to the laser question. In practice, we usually talk about three methods: LASIK, femtolasic, and Smile Pro. LASIK is the more classic approach. Femtolasic uses a femtosecond laser instead of a mechanical blade for the flap step. Smile Pro works through a very small opening and does not create the classic large flap. For the patient, this is not just a set of names. Each method has its own advantages, limits, corneal thickness requirements, and prescription ranges. So the question is not which name sounds modern, but which method is safest and most suitable for your eye. Who do we usually consider a candidate? In general, an adult whose vision has been stable for at least a year, whose cornea is thick enough, who does not have active inflammation, severe dry eye, keratoconus, or other conditions that could make surgery unsafe. Pregnancy and breastfeeding are also common reasons to postpone the decision. If a person has diabetes, autoimmune disease, or chronic ocular surface problems, we evaluate everything separately. Laser correction is not a race. The winner is not the person who comes first. The winner is the person for whom the operation truly fits. Before surgery, we do not guess, we measure. We check visual acuity, perform corneal topography to see the shape of the cornea, measure corneal thickness, check intraocular pressure, examine the retina, and, when needed, evaluate the tear film and tear quality. These data help us decide whether laser is safe or whether we should first treat dry eye or even choose another route such as ICL. The important thing is not the idea of getting a laser, but understanding exactly what is happening in your eye. The surgery day itself is usually calm and fairly quick. You first go through preparation, then the laser stage usually lasts only a few minutes per eye, and then you go home. But the operation is not the whole story. The first day and the first week matter a lot. Temporary tearing, light sensitivity, a sandy feeling, or short-term burning can happen. Usually this is expected and passes quickly. What really matters is following the drops schedule, keeping the eyes clean, avoiding rubbing, and protecting the eyes from water and makeup until the doctor says otherwise. Good results depend not only on the machine, but also on careful aftercare. There are also myths we hear almost every day. The first one is, laser can make you blind. In real practice, the more important questions are much more practical. Was the method chosen correctly? Was the cornea thick enough? Was there a hidden problem? Is enhancement needed later? The second myth is, if I do it once, I will never need glasses again. Not always. After 40, presbyopia can begin, and reading glasses may still be needed. That is not a failed surgery, it is an age-related change. Another myth is, laser is equally good for everyone. No. Sometimes the best option is not laser at all, but ICL or another method. One more thing that matters is follow-up. The operation itself is only one step. We also explain when to come back for checks, how to use the drops, when you can wash your face, when you can return to sports and when it is smarter to wait a little longer. That recovery plan is part of the result. So the right question is not, will you do laser for me? The right question is, which method is safe and suitable for my eye? You cannot answer that honestly from a chat message, and you should not guess. First comes the full examination, then an honest conversation about options, risks, and expectations. At Ko'z Nuri, that is exactly how we begin. Diagnosis first, then choosing the method, and only after that discussing surgery. That way the decision stays calm, clear, and truly yours.